Thank you so much. That was a lovely introduction. Good morning, good afternoon, good evening, no matter where in the world you are today. Let me start by first thanking our real heroes in this once-in-a-lifetime crisis. Our providers, our clinicians, our nurses, and frontline staff, who are on the front lines risking it all for us, tirelessly going in every single day to battle this pandemic. At KenSci, we have been partnering with some of our leading health systems to support them in any way possible as they marshal all their resources to address the challenges on hand. Our latest product offering leverages the cloud and open standards to provide health systems with real-time visibility into their critical resources like bed availability, ventilator usage, surge forecasts, all built on the same award-winning cloud-first architecture that we have hardened over the last few years with the great fortune of working with some of the largest and most prestigious institutions across the world. One such health system that we have been working with is St. Luke's University Health Network, located in the picturesque Lehigh Valley of northeastern Pennsylvania. Dr. Jim Balshi, a friend, colleague, and someone I respect a lot. Let's talk a little bit about how your organization is right in the middle of this. And you, as a CMIO of a large health network at St. Luke's, let me ask you, what are some of these challenges that health systems are faced with right now? Give us a sense of what it's like to be in the hallways of a health system like yours in a moment of crisis. Dr. Balshi, take it away.
Thank you, Rohan. St. Luke is in a particularly unique situation where we are approximately 65 miles west of Manhattan and about 50 miles north of Philadelphia. We have two major thoroughfares, both Route 80 and Route 78, that bring employees and now patients in and out of the New York City and Philadelphia areas. We have been watching the collapse of the New York health systems under the weight of the COVID-19 epidemic and have really been suffering, waiting for that shoe to drop on the Lehigh Valley. But it's also given us a tremendous opportunity to plan and position ourselves to be able to absorb this influx of patients. Using some of the technologies that we've had and sharing some of the models that have been offered, we've looked at potential growth in several areas of our network. We happen to have a campus in the Monroe County of Pennsylvania, which is the site of the first death in Pennsylvania. And we have been scrambling since that time to really position ourselves in a way to absorb a massive influx from both the New York and Philadelphia area. Using some of the modeling techniques that have been offered both publicly and working with our partners in the machine learning industry, we've been able to look at staffing, bed allocation, training, and equipment, particularly ventilators and personal protective equipment. By using the technologies, we've also been able to stratify where we would position our patients and how we would continue to monitor our patients. At this point, we feel like we are prepared, but we are anxiously waiting for those increases to occur, at the same time hoping that we're seeing some flattening of the curves.
Thank you, Dr. Balshi, for your comments. Really loved listening to that, and can't even begin to imagine what it's like to be in your virtual command center at this time, for being a health system that recorded the first death in the state of Pennsylvania, as you alluded to, in Monroe County. But I do feel a sense of optimism and excitement around the fact that you mentioned that there were some modeling techniques that were being used to help the system plan for future surges that might come about, a lot of which we will cover in detail as we go along in this discussion. So thank you so much, Dr. Balshi, and like I said, thank you from everyone and to your team and your extended team for all of the amazing work that you guys have been doing. Next, I'd like to hand it over to Heather Cartwright, who's GM at Microsoft Health. Microsoft is an incredible global power. We're fortunate in that we tend to be in their backyard here in Seattle, Washington. But Heather, give us a sense of what Microsoft has been doing on the forefront of the COVID response. What are you seeing, learning, as Microsoft has been working closely alongside health systems, but also local, county, state, federal, and international governments to really help health systems such as St. Luke's and people like Dr. Balshi and his team be better prepared or fight this time of crisis. Heather, over to you.
Thanks, Rohan. People have been using the word to describe this as unprecedented, but if we look technology perspective, I'm not sure everybody's really seeing the long-term impact of what's actually happening right now when it comes to healthcare and technology. We were already in a movement of change in the healthcare industry where we were looking at taking data stores that sit on premise and move them into the cloud. That change was happening very rapidly. We were looking at open standards and collaboration. As we look from a technology perspective of that, as that move, what's happened with the COVID-19 scenario is it has poured fuel on that fire and is really accelerating not only awareness for the need for it, but real need in real time. I have not in my own career seen anything transform so rapidly as I have over the last several months. And I say months because one of the biggest changes that we've seen, particularly on the front lines of looking at COVID, is so first of all, it's the biggest trigger for change that I've seen in my career. I think for the many people around the globe, it's the first time in our lifetime that we're seeing something that we can't fight in our own environment. This is not a US problem or a problem in Asia or a problem in Europe. This is something that is triggering collaboration. When we look at the way the front lines are trying to respond to the COVID scenario, we are having to look beyond our own borders. We're having to look beyond the data that's sitting in front of a physician, and we're having to learn from other systems. And so the collaboration of how we do that is really challenging our front lines because they're unable to support the needs for things like ventilators and the forecasting of beds. Analytics that many hospitals have today for forecasting where they're going to be at max capacity, what their staffing needs are, they don't work in this scenario. And so we're having to look to see how other regions have responded that it maybe hit several weeks ago, several months ago. When you're looking to China, we looked at it in Seattle as one of the first areas that got hit in the United States. We looked to Wuhan and some of our Microsoft teams in Wuhan to say, what were you doing out there? How did this happen? And we used some of those modeling the models, the data sets to try and apply that to U.S. scenarios. And we've seen that spread across the nation in the United States. We've seen it moving over to Europe. And so that's been a really powerful learning for us. I think on the most immediate level of the front lines, the third thing I'll mention is really the power of simplicity. When you're looking at how to get data around most rapidly, it goes to the lowest common denominator. Unfortunately, the challenge of interoperability is really highlighting for us right now because the lowest common denominator, especially when we hit some of the things that Dr. Balshi was referring to as far as where supplies need to be sent, where we need extra support. The lowest common denominator in many cases when you're looking at a national scale is phoning in every day what the availability is and the capacity is. what we have a huge opportunity to do right now, and we are starting to see, is moving to leverage the technology that we have in place that wasn't necessarily intended for bed capacity, but it was used for other things. Companies like KenSci that had some of those networks available have turned quickly and reapplied some of the pipelines that they have for HL7 messaging, CCDA, and are using them in the COVID crisis. That's where we're seeing the most speed and the most rapid responses. So it's really challenging us all to rethink how our technical operations work in the front lines and reapply them in new ways.
And if I can just touch on what Heather said, the situation has prompted a phrase in our network that oftentimes what we see every day is that virus trumps strategy. We were in the middle of a digital transformation process in our network, rolling out Windows 10 and Microsoft 365. We had a platform for on-demand telehealth, but had never scheduled a telehealth visit in our network. And in 2 weeks, we've gone to 28,000 scheduled telehealth visits using Microsoft Teams. At the same time, we were in the process of working with KenSci to look at length of stay and readmission, and we were able to take our infrastructure communication with KenSci and repurpose it to looking at the population health. So the agility that this crisis has created for us has been, to use that term again, unprecedented, but also it's very interestingly illustrative of how the right technology, well, maybe it's not been deployed yet, can suddenly be put into action.
Thank you, Dr. Balshi, and thank you, Heather. Fantastic summarization. As I've been telling my family across the world, this is the ultimate equalizer for all of us as human society. And it's the one thing that, at least in my lifetime, we have been all experiencing the same anxiety, the same feelings, no matter where we are in the world. And as Heather mentioned, it's incredible that with the use of technology and better data capture, we're able to very quickly learn from our fellow citizens, no matter where they are and no matter how many oceans separate us, to really learn from the times that they might have gone through as we sort of approach a similar trajectory. So thank you, both Heather and Dr. Balshi. I'd like to go into the next section where we'll talk a little bit more about technology. And Dr. Balshi, I would like to start with you. Tell us a little bit about the role, the very interesting role as a Chief Medical Information Officer spends. Most health systems know the CMIO as really helping drive the EMR conversion and the early days of moving into your first system of record digitalization. But most systems today have their EMRs behind them and are using that as a catalyst and the wind in their sails to do further innovation. What are some of the technology components that you're really bullish on as you approach more systems of insights and taking advantage of the technology investments that your system might have put in place over the last decade and beyond? So Dr. Balshi, over to you.
Thanks, Rohan. As a CMIO, I really have 3 areas that consume my attention. Obviously, the first is the electronic medical record, and we happen to be an Epic shop in our network. The second area is really looking at the analytics that we can leverage using the data in our EMR. And then the third area, and this is critical to, I think, the core mission of healthcare, is our ability to communicate both between physicians and nurses, but also between physicians and physicians, and also with our patients. And so communications is a big part of the technology. But getting back to the core EMR technology, what the EMR has really evolved into, aside from keeping accurate and comprehensive records on patients, is a system of clinical decision support. And using the technology within the EMR to help us apply best practices in individual situations is really the core value in an EMR today that offsets the challenge of entering more data and managing that data within the patient-physician interaction. On the analytics front, using the power of the EMR data to help us become more efficient, we have been exploring things like the deterioration index or the sepsis alert system or the risk of falls and readmissions to hospitals, and trying to keep patients in the home, out of the hospital, and in a better state of health. The analytics allows us to look at strategy. Where do we need to add services? Where do we not have the facilities that are necessary to serve our populations? So we view the analytics portion of the EMR and the data around healthcare as being really key in developing our long-term and short-term strategies. And part of the evolution of the analytics system is sharing that data with other organizations in various forms, whether they be large cloud-based data lakes, or are they federated databases that can then be analyzed with machine learning and artificial intelligence algorithms. So we see that as becoming a bigger and bigger part of how we manage the data and take advantage of its internal value. And then the third part, the communication, it really has been a journey. As our network has grown, we've acquired multiple practices, some hospitals, and in that process, the whole communication infrastructure has really been a major challenge, some of which are end of life and out of date. Others are expanding rapidly, and how do we add that technology for communication? We found that working with Microsoft has really been a tremendous advantage for us in communicating using platforms like Teams and being able to maintain a level of communication that keeps our physician-patient interaction very much in touch with our administration and our underlying business interests.
That's amazing. I feel like in healthcare, we love abbreviations, and I feel like we just came up with a new one called RAC, which is Records, Analytics, and Communication. And I love that framework, and I think it's a perfect opportunity for Heather to comment and give us some insights into, as you're on the front lines leading Microsoft's approach to responding at this moment of crisis, but more importantly, just underlying the foundation for technology innovation and acceleration, both for health systems, but also for partners like ourselves and KenSci. What is Microsoft doing to assist in the process, really around maybe the record keeping, the analytics, and the communication side? And do you think we're living up to the promise of what went into all of that money around meaningful use to assist with interoperability? I feel like this is the perfect test for the industry to shine and show that we have figured out interoperability, and it's really easy for health systems to now share records, but also do downstream analytics. So Heather, can you offer some insights and chime in into what Microsoft is doing?
Yeah, you are absolutely right, Rohan. This is the time for technologies like FHIR, which are open standard, really to shine. Interestingly enough, in the midst of all this COVID chaos, the HHS, for Health and Human Services, and ONC announced the final rules the first week of March that actually pushed forward the use of FHIR for data exchange. That's been an evolving process as we've moved towards it. But right now, we are absolutely seeing the benefits of that open framework. When we started finding COVID in our healthcare system, there were no codes in our existing record system to document that condition. And so what we started to develop was a smattering of different ways healthcare systems were starting to document the different therapies they were trying, the different conditions that patients were having. And that data is in the system, and it now needs to be mapped to, now that we have an actual billing code for COVID, mapped to the latter half of the hospital system documenting data so that we can put them together. That is exactly where cloud technology and analytics come together to help. And so FHIR is a framework where you're allowed to bring old data sets and new data sets together as it evolves, and it's helping us in real time start to figure out the trends that are happening. You mentioned records, analytics, and communication. I think about it as really just it's from a technology that Microsoft is bringing to bear right now, and where we're seeing our most powerful use is really in the analytics and the application side or communication. For sure, from an analytics perspective, the FHIR technology, and full disclosure, I have been a FHIR evangelist for the last 5 years. It is, to me, it's heartening to see it in real time, really proving out what we have talked about for so many years. Recently, we released a lot of technology around HL7 converter, where you can just do an API call and send HL7 data in and get a FHIR record out. We released tools for anonymization, so you can quickly extract data from a FHIR service and exchange with redacted data and date shifting. We have the API for FHIR, where folks can spin up cloud FHIR services for exchange of data. And then the extraction of it into Power BI. We have a FHIR converter for that. We are seeing in real time people spin up these tools and being able to do analytics to do immediate response in the hospital systems like never before. So it's been really, in some respects, it's been not only heartening, but really eye-opening to the power of what we can do with health data in the cloud when we are all working under the same framework. And then on the other side of the table, when you look at the application scenario, one thing that I'm passionate about with FHIR is when we are exchanging in FHIR APIs, when you bring data together from different systems, and when I say different system, we're looking now at demographic data, at all the different triggers that we might be seeing that are leading to COVID. So these are different data sets that don't normally reside in health systems. They can use FHIR to map the outputs of their analytics back into the health system. We're seeing that in the applied world. We have piped FHIR APIs into a lot of our interaction tools. And so we are seeing that use in the applied world right away with things like bots. Bot technology is build it once and you build the Q&A for patients to understand how to self-diagnose whether they should be going to the ER or not. We're seeing it in nursing care, and we're seeing that explode across the globe, really, and being able to use many health systems be able to use it in real time and very rapidly. Telehealth, Dr. Belshi talked about that. It has been really powerful to see the growth not only of telehealth, but also the Internet of Medical Things. We are quickly building a world where people will be doing more healthcare in their home environment, self-monitoring and tools and technology. And having a FHIR connector for Internet of Medical Things is something that is going to really be, I think, mainstream in about 6 months once the systems are up and running. And we're seeing it already. We've seen definitely a growth over time, but this is really going to be the catalyst to transform how healthcare is delivered.
Heather, thank you for summarizing your piece around what Microsoft is doing and how bullish you are on the FHIR open API standards. I share that same sentiment, and it's amazing to see FHIR come to bear after all these years, going way back to the Jason task force that spun out of the government to go and figure out the interoperability problem plaguing our systems today. I also commend Microsoft for making this a first-party citizen to allow for customers to take advantage of out-of-the-box capabilities and offering, but also more importantly for vendors and partners to not have to recreate the wheel and just take advantage of these open source and open standard offerings that today exist as first-party citizens within Azure. I can tell you that KenSci has taken full advantage of this versus having to recreate an HL7 conversion API or a Fire bundle API that needs to expose predictive insights or descriptive insights into Smart on Fire applications or even EMR integrations. It's really what we've taken advantage of for our mobile offering that provides health systems with real-time bed availability, census tracking, ventilator use, and laying the underlying framework to do predictive analytics around vent deterioration and various other components that might be of importance to health systems. So thank you so much. And Dr. Balshi, thank you also for giving your bullish response on what you think the role technology plays. Last part of our conversation, I'd like to quickly summarize and really talk about what are the learnings from this experience that we've all talked about as being a once-in-a-lifetime experience for all of us as human society. How should we think about today and the insights that we take from today to bring it into tomorrow? Are there better things that we need to do? Are there signals in our data that we need to start paying very close attention to? Because we all know that this was going to come back at some point. It's not a question of if, it's a question of when. So Dr. Balshi, maybe if you can tell us a little bit about, are you bullish? Are you bullish on your technology investments, on the promise of AI, on the promise of interoperability to help a system like St. Luke's be better prepared for the future? And are you leaving behind something really good for who is to come next as clinicians, as nurses, as providers, and as administrators? Dr. Balshi, over to you.
Thanks, Rohan. And yes, we are absolutely bullish on taking advantage of the technological process that we've evolved through in this COVID crisis and translating that to what we thought was coming down the road, but now can clearly see the value in it. If I can speak initially to your enthusiasm and Heather's enthusiasm for FHIR, what we are seeing now is truly a transformation in the way healthcare will be perceived. I have the advantage of maybe a long-term view, having begun my practice several decades ago, and understanding that the old model of seeing a patient on a yearly basis is clearly of historic interest only, as we've gone from better interaction with a patient at a 6-month visit, at a 3-month visit, and now with FHIR empowering IoT devices, actually seeing patients and seeing their information flow into our systems for analysis, not only on a daily basis, but sometimes multiple times a day, allowing us to really evolve and curate the way we take care of patients in a fashion that we've never had access to before. This is creating big data, which requires a lot of help from our industry partners and KenSci in particular in managing that big data to allow us not only to see how to handle patients in the acute care hospital-based system, but also the population health for value-based initiatives and how we are able to then monitor those patients with chronic conditions and be able to refine their care, not on a yearly, a 6-month, or 3-month basis, but actually on a daily basis. And on the acute care side, to be looking at real-time information that informs not only our EMR, but the clinical decision support that the EMR provides us with through items like the command centers, where we are actively tracking patients as they deteriorate and intervening earlier. So the role of data in healthcare and the maturity of the way we handle that data and translate it back to the bedside is really rapidly evolving, and I think in the right direction.
Thank you, Dr. Balshi. Love your excitement around data and its use in real-world application. It sounds like St. Luke's is very nicely set up, both from the investments that you've made on the technology side, on your core system of record, as you mentioned with Epic, and then also in other investments around the cloud. It's so great to hear you being an early adopter of taking advantage of data lakes in the cloud to unlock analytics capabilities downstream. I'd like to use that same sort of movement and point back to Heather. Heather, how do you see Microsoft evolving its approach as we look at both the short-term and long-term impact of COVID-19? I think you've already touched on the fact that we are going to approach a new normal. What are their needs from technology and the role that technology plays as we look at COVID-19 and beyond? What is the learning from this crisis that we can take forward and leave a lasting impact?
One of the things that also is coming up frequently is discussion around the proverbial camel hump of a virus. So we have the first round that we're going through, and a lot of folks are looking forward to say, when is the next? We'll go into a lull, and then it will surge back. When will that happen? Will it happen? And as we think about data systems and the technology that we are starting to put in place today, and as we build for the next 6 months, 1 year, 5-year mark, to me, there's really 3 areas that are very different when it comes to technology and application. So the goal is to try and think about your systems, because we're going to take a pause here, hopefully, and everybody's going to come up for breath and say, okay, how do we prepare for the next round? What do we do? The goal is to build it once and use it for all 3 of these scenarios. The first, but they're very different. The first is really just about fast response. So if we are facing a global pandemic again, I think we're all aware that no single system is able to support the demand for ventilators or the demand for staffing and beds immediately. And so how do we build a network that we can go for very rapid response? This is not something that we have months to set up. It'll be days. And so how do we create a technology flow just for that operational capacity to meet the immediate needs of the front lines? We're getting masks, we're getting vaccines. Hopefully they'll be here at that time. We're getting test kits to the right place at the right time. The second level of data is how do you get your data in a state where you can do rapid analytics in real time? So this uses different technology. This is more around getting the data from your hospital system, your operational data and your patient record data in a place where you can do rapid analytics to see what is happening. So putting it in a system where you can quickly connect to tools like Power BI, so your clinician researchers, your frontline staff can start to use that data to their advantage and augment what they're doing. The third is really where the long term happens. And that's these big data sets that we are starting to really see come together in the advent of COVID, because we need to understand more about this virus that is not available in the silos of our provider or payer or pharmaceutical networks today. We need to bring data together for drug discovery. We need to bring data together in the immunology space. We need to bring data together about the social influencers of health and how that might be impacting who is getting most impacted by COVID, who is fighting it, who is resistant to it. And that's really the big data scenario. It's a little bit longer term, but it is very possible in building an architecture for your hospital system and thinking about how you evolve in the next few months to support that scenario, as well as what you need on the front line for the fast response. And so I think about it in those 3 stages, but thinking about open standards, thinking about tools that support those open standards allows you to move with agility and be really responsive when it comes to the needs of global healthcare.
Thanks, Heather. In summary, I think what you mentioned is take advantage of what's already out there to then permeate across the organization, leverage the open standards, take advantage of cloud scale and distributed compute on platforms like Microsoft Azure to do rapid analytics, what used to take a long time to even figure out or fathom maybe a decade ago or even 3 years ago, is now just a couple clicks of the button. And then last but not least is really this collaboration of bringing together data sets that might exist within our community to help accelerate drug discovery, contact tracing, who might be immune, what type of immunity might exist within the community. So both Heather and Dr. Balshi, this has been a fantastic conversation. I want to thank you guys for taking the time out of your really busy schedules across different time zones. I hope that our listeners will find some nuggets of information in here that they can bring both to the forefront on the technology delivery side, but also on the application of clinical medicine and process across health systems. Once again, I want to thank Dr. Balshi and the team over at St. Luke's and every other healthcare worker out there today, no matter where you are. Thank you for doing everything that you are doing. And for health systems that want to know more about KenSci's product offering, both that, the three things that we're offering our customers around the real-time tracking, as Dr. Balshi has mentioned, as being an important area that Heather has touched on, leveraging open standards to give health systems the ability to identify bed availability, real-time census, and then surge forecasting. Check out our webpage at covid19.kensci.com and also our Microsoft Azure Marketplace offering that can be enabled really with 2 clicks of the button. And you could install our components within your existing Azure environment. Links to resources will be up on the webinar page, so take a look at that. And with that, I'd like to close out by letting everyone know that we're here to help. Your vendors are here. Your health system is ready. Just stay strong, stay safe, and stay healthy, and also stay home, because we've shown that does help bring the curve down as we are seeing across the board. So thank you, and we will talk soon.